Seen some research suggesting low serotonin in long COVID. Curious how this relates to the autonomic system. Always hear about epinephrine, norepinephrine, but not so much about serotonin. Ooh. So there's this idea. I like to follow some investing principles. It's just a thing I like to do. I think it's fun. I studied it a little bit. And they talk about this concept of you being generally right on something, meaning like you're directionally right, but you may not have it specific, but you're in the zone. You're in the right area. And then you can be specifically wrong about something, like meaning you can model things out, get super, super detailed, get very, very specific, and spend all that energy to be exactly wrong. So when we start to talk about neurotransmitters, there's a danger zone here because we think about neurotransmitters acting in the brain as though they're their own individual agents. Instead, it's worth remembering that neurotransmitters are sent by something to speak to something. So they are just messengers, right? So it's like in the movie 300 when the Persians send the messenger to the Spartans, right? And he just boots them down the well. So in this case, when we're thinking about neurotransmitters, these are just substances hanging out in a neural cleft. And that's really important. And then like we use them and we manipulate them as a way to to be able to provide signaling to cells. But also when you send a receptor across the cleft, you have to account for the receptor and the type of receptor that's coming down, that it's going to. So for example, you may have cells within the basal ganglia that have teens worth of receptors for dopamine. But each one of those receptors is in charge of a different task. So the actual neurotransmitter itself, when we're looking at these two clefts talking to each other, we've got some neurotransmitters that come by. So when we measure neurotransmitters at the brain, we're trying to just get a sample of what communication is happening. But whether or not the chemical imbalance nature that was governed the 90s has been largely kind of disproven. And that's really important because, so if I'm looking at something like I got low serotonin, for example, if that is true, then what it's saying is that the nerve endings that are using serotonin are not able to, or not communicating effectively, and we're not seeing it project serotonin to the next level or to the next cell. And then you can apply the same things to epinephrine and norepinephrine. So looking at these as a mechanism for understanding what is going on specifically in the brain makes it really hard, because you're saying we're gonna aggregate the amount of communication that's happening without knowing the type or nature of the communication, and then try to make some sort of an assumption based on that communication. And I think that will lead people to be largely specifically wrong about what is going on. So if you have low serotonin levels, what you're saying is like the nerve endings that are using, or the neurons or the dendritic cells that are using serotonin as a transmitter aren't communicating to the degree that we would expect them to, and we're not measuring it, and et cetera. But if you think about that in terms of like how well your brain is functioning, if it's not communicating as well, there's not going to be as much exchange of neurotransmitter, and then therefore we're not going to see that show up in the way that we would typically measure neurotransmitters in the brain. So I think that that's really important when it comes down to function and thinking about it in terms of like, how are we going to get it better? Because we already know that we throw meds that do that. All we do is just upset things, generally speaking, and sometimes people are able to find like some relief from that. Sometimes they're not. It's a coin toss. If you look at the outcome data on that, it's not much better than, well, never mind. I wouldn't say that it is what we should aspire to in terms of our outcomes. So not to say I'm not critical of people doing that work. It's very academic. But in terms of like how would you solve it, what you would want to understand then is how is someone being active within their brains? Like what tasks is someone doing? And then look at, how does that overlay with serotonin levels? So if I have a bunch of people that are laying down all day, the amount of impulse that's going to go to their head and going to be exchanged in the brain is going to be different than someone who's up and around and active, or someone who's looking at a computer, or is going to be different than someone who's, pouring concrete, for example. So I think a more useful way to look at it is actually in terms of individual system pathways and understanding, hey, how well are these different systems communicating within the system, rather than trying to take a large view and looking at neurotransmitters writ large, because it's a hard way to be able to be right about anything tangible. So that's not a criticism of you, Cameron. I like that question a lot. That is my perspective, or that is the way I would think about that story. Is I would be less interested in the serotonin levels. I would be more interested in where it is coming from and is it being signaled. How can we tackle that problem? Okay, can you explain how to know whether legs need to be raised, like in a recliner, versus when they need to be above the heart? How long should one stay in that position for full effect for both POTS and lymphatic symptoms? Okay, so I think we're starting off with some assumptions here. So legs need to be raised like in a recliner versus over the head or over the heart. You're looking at a gradient of the same thing. So if I'm just elevating my legs, I'm reducing the amount of draw of gravity to the floor. If I'm really hiking my legs up, I'm using gravity as a way to bring it back to the heart. So I think to know how to know when to do each maneuver is going to be based on what you are trying to accomplish and what problem you have. So without knowing that, it's hard to say. I would say that if we're going to say you're going to be hanging out in a recliner, it's to be able to put some neutrality in the system, allow blood to circulate a little bit easier without being under tension or under load. If we're putting you up against the wall, legs in the air, then this is considered a recovery position, and it's a little more emergent. And this is for somebody that's actively having a hypoperfusion event in their brain, and they're not getting enough flow to their brain. We're trying to increase the volume back to the heart, pump it to the brain, and be able to resolve that problem. So one is kind of more like we're hanging out, and one is kind of be a little bit more emergent.